Could Lebanon become the new coronavirus hotspot? Many believe so, as the country has been reporting record-breaking daily cases following the holiday season, with numbers exceeding 5,000 per day in the last week. Dr. Samir Naameh, pulmonary and critical care physician at St. George Hospital, says hospitals and medical staff are struggling to cope.
In the healthcare facilities, it's even more chaotic because all the hospital wards and ICU are full or nearly full. So we are starting to hospitalize the patient in the ER. We are starting to treat them in the hallways, in the outpatient clinic, in the clinics, and even some patients are receiving oxygen in their own car. So the whole situation is really stressful, both physically and mentally.
The situation is equally stressful for COVID-19 patients themselves, many whom were turned away by hospitals. Dr. George Karam, a psychiatrist who recently contracted the virus, says he is worried as medicines are missing due to the economic crisis.
My physician asked me to take 2 antivirals, and I started going from pharmacy to pharmacy trying to find these medications, and they were nowhere to be found in Lebanon. I was always very anxious that my symptoms will get worse and I will need to go to the hospital, and there's no place for me.
A 25-day lockdown with a long list of exceptions went into effect on January 7th, but the exceptions and violations seen are rendering the measures mostly ineffective. The dire situation has prompted the Higher Defense Council, chaired by President Michel Aoun, to impose a full lockdown and declare a state of emergency between January 14th and 25th. It remains to be seen whether the new, stricter measures will curb the spread of the virus and save the health sector from total collapse.